So now let's discuss conducting ethical research. The American Psychological Association has some guidelines for making sure that we're conducting ethical research, and they begin with do no harm. They also include accurately describe risks to potential participants so that potential participants can opt out if they would like. Make sure that those participants know that their participation is voluntary. Don't make the participants uncomfortable in any way. Make sure you maintain their confidentiality. Don't invade their privacy. From time to time, it's necessary to use deception in an experiment. Don't do it only, do it only when absolutely necessary. Make sure you provide a debriefing at the end of the research to all participants so that they know what the study was about. Provide results and interpretations to the participants. Make sure you treat the participants with dignity and respect, and make sure that they can withdraw at any time, for any reason if they would like. Related to conducting ethical research is the discussion of conducting animal research. About 7 to 8% of research in psychology involves animals as subjects. 90% of them are rodents and birds. About 5% are monkeys and other primates. It's pretty rare to use dogs and cats, but they are from time to time. And you must demonstrate a clear purpose, such as benefiting human or animal health, in order to conduct this kind of research. It also requires excellent housing, food, veterinary care, and so forth, and you need to make sure you minimize any pain and suffering to the animal. The APA provides guidelines for the use of pain, or basically guidelines for pain, surgery, stress, and so forth, as well as termination of an animal's life, and these are about the same as local humane societies provide. There has been questionable research, in fact, downright unethical research. I don't know if you even want to call it questionable. An example of this is the Tuskegee syphilis experiments. So from 1932 to 1972, prisoners, soldiers, mental patients, and others were exposed to syphilis and gonorrhea to test the effectiveness of penicillin. The U.S. Public Health Service recruited about 400 poor African American men who had contracted syphilis to study the progression of the disease. None of these people were even told that they had syphilis, and none was even treated, even though penicillin became the standard of treatment in about 1947. So these were people who were actually infected with the disease, weren't told that they were infected, and even though the U.S. Public Health Service knew they were infected, weren't provided with penicillin, even though it was the standard. During the 1940s, the U.S. and Guatemalan health officials deliberately exposed prisoners, soldiers, and mental patients to syphilis and gonorrhea to test the effectiveness of penicillin. So let's go back to this for a second. Obviously, this is quite unethical, awful act. And at the same time, it did happen, but after some time led to kind of an overhaul of ethics in the American Psychological Association and in experimental research in general. There's another type of ethics that we need to pay attention to, and that's plagiarism. The idea is to cite your research references. So when you come up with an idea, or somebody provides you with an idea or previous kinds of information in literature and so forth, it's important that you sort of give them their due by providing information about who they were, where it's published, and so forth. So you can see that here in the citation, there's the author's names, the date of publication, the title of the article, the name of the journal that the article is written in, the journal volume, the pages, and often there's a digital object identifier, which is just kind of an identifier for online access. So, brief overview of ethics in research, but it's an important topic, obviously.